So this first one was the influence of timing for reporting concussions. So there's been several studies done over the past few years. This study included 12 previous studies. And what these studies were looking at is people who get a concussion but then continue to play in the same game or don't immediately report that they've had a concussion. What does that recovery time look like? And I mean, this isn't surprising because all the evidence leading up to this particular systematic review and meta-analysis has basically demonstrated that those who continue to play have a significantly higher chance of having a prolonged outcome. And you can see this in this conclusion here. Patients who delayed reporting or continued to play had longer recovery times compared to their immediately reporting peers. Providers should ask concussion patients approximately how long they waited to report their injury, and also focus on educational efforts on encouraging immediate reporting of concussion. And you can see here the time expressed in raw scores. Those who immediately reported recovered in 5.4 days, fewer than 5 days fewer than those who delayed. So basically a 5 day difference in terms of recovery. Collectively, the findings of this systematic review and meta-analysis support the notion that immediate reporting of concussion-like symptoms and earlier evaluation by a medical professional can positively influence concussion outcomes, including time to recovery, likelihood of prolonged recovery, and symptom presentation. So this is something we try to get across to athletes is I know that you want to play in your game. And so the incentive there, at least at the time, is to continue to play, maybe hide the fact that you have a concussion, you're not feeling quite right. But the reality of it is you end up being out for longer if you don't. So it's kind of using that as a tool to potentially, hopefully at least incentivize people to report their injuries.